Now, I want to talk about the NHS because thousands of doctors have staged their 11th walkout yesterday in a long-running dispute with the government over pay and working conditions. Obviously, hospital services have been disrupted deliberately just before the UK general election. Let's talk about how the parties are addressing the NHS. Obviously, there's one particular party which has got an expert on these matters, Dr. David Bull. Let's start with you.
Look, Andrew, it's a complete mess, isn't it? It's a shambles, and everyone keeps saying, oh, the NHS is the envy of the world. It's not. We spend a lot of money on the NHS, £176 billion. That's 11.7% of our GDP. It's about the European average, if not more. And yet, when you look at that, our outcomes are terrible. 380,000 people did not start cancer treatment in the allotted time. Now, if you do not start your cancer treatment, you do not do very well, and your prognosis is far worse. When we look at our cancer survival rates, in fact, when everyone says, oh, look, we're doing really well, when you compare it with Europe, we are 20 years behind Europe. So something is going horribly wrong. Now, the money is going in at the top. It is not reaching the patient at the bottom, and it's going out of the side. And I have a big issue with a number of managers, diversity roles, all the nonsense that the NHS has built up over the last few years. Now, in terms of the junior doctors' strike, this is deeply political, isn't it? I mean, the timing is so suspicious. This is their 11th strike, by the way. And the impact to patients is really real. 1.4 million operations and procedures have already been cancelled. And I've spoken to those people who, for example, if you need a new hip, you're in terrible pain, chronic pain, you're told, oh, your operation is whenever, next week. So you look forward to that date. I've been talking to people who've been postponed 2, 3, 4 times. It's not acceptable. And also the junior doctors are asking, and look, I understand what it's like to be a junior doctor because I've been there and it was horrendous. Although I would add, we used to do far more hours than they are currently doing. And that will win me no fans with junior doctors watching this. But we used to do far more than that. But they are asking for a 35% pay uplift. There is no way they are going to get that. Even the Labour Party says we cannot afford to give you a 35% pay uplift. So I've got in my policy, which I wrote, I am saying that actually all frontline health and social care staff will pay 0 basic rate tax for 3 years. That is a significant move. And actually, that's about a 13% pay uplift, but actually doesn't affect the basic budget of the NHS, as you can see. So they would be happy. Also, I want to underwrite tuition fees for junior doctors who are training. So if you stay within the NHS for 10 years, we will underwrite the entirety of your fees. So you've got to understand where this tension comes from, because it's really expensive to become a doctor. And also, when you're there, you're not treated very well. And it's the simple stuff. There's no hot food. There's nowhere to change. There are no on-call rooms and stuff like that, which is really important. And I think you have to have been in the service to understand quite how awful it is.
Nick?
I don't know that much about the NHS because I've never worked in it. So I can only speak as a user of the NHS and someone who has half their family working in the NHS as we speak now. The NHS is a bit like mass immigration. This is the first election I can think of where people are willing to talk about the NHS in a negative light now. We didn't do this a couple of years ago. It was still the holy cow of politics. People are beginning to see through their use of the service that it doesn't work. We're spending millions on diversity managers. We have hospitals painting rainbow foot crossings across roads outside their hospitals. The waste of money. And the people I know who work in the NHS tell me stories all the time. Not only of staff who don't care, and I'm sure they're a small percentage, but staff who don't care. Managers and other staff walking around having to clear up the mistakes of other staff because you can't sack anybody, you can't discipline anybody. The way that nothing works, we can't get appointments. I lost a tooth last year. I'm 56 years old, I think. And last year was the first tooth I've lost as an adult. And the reason why I lost a tooth is because it took me 3 years to get an NHS dentist because I couldn't afford to go private. And when I finally got an NHS dentist, the dentist looked at it and went, all too late now, Nick, has to come out. And I've been paying all my life for this service and I can't use the service. It's disgraceful. What the big answers are, I don't know. But we need change.
Well, one answer, which I often advocate, is the use of technology and, in particular, artificial intelligence. And there was a research done in the University of California saying that chatting to Chat GPT was more empathetic and more effective than chatting to your GP if you can get an appointment, because it has more time, it's got more information and everything. What are your views on embracing technology, David?
You are totally biased, Andrew. You and AI, you have an AI obsession. Look, of course it has a role. I'm not sure about the consultation side of it. But look, yes, certainly. I mean, for example, if you have a chest x-ray done, why are we waiting so long for that to be reported? That is the role of AI, because it can scan loads and loads of images, decide, is there anything suspicious, and then hand it over to a clinician. Equally, you could say, why don't we get all of these reported in a country with a different time zone? So it's all done overnight. You then get a response the next day. So the whole thing is absolutely bonkers. When you go to see a GP, and I'll take the practice I go to, you will then be, you go see the GP, they will then make an appointment for a blood test. You then have to take the appointment for the blood test. The bloods are then sent off. You then wait a week to hear the result of that blood test. Why? Why are we not doing this much faster? So what I want to create are these diagnosis and treatment centres where you go in, you have your bloods done, you have your chest x-ray, you see a clinician, all done, one go, and our prognosis would improve, and actually the care of people in this country would get better.
Yeah, absolutely. And well, the reason I advocate AI so much is not just about helping to cure diseases, and we're hearing great news all the time, but it's also about efficiencies. And if it can introduce efficiencies, whether it's diagnosis or other things, that's got to be good. Do you have a take on it, Nick?
I do. I think if you really want to improve the NHS, we need to look at one thing and one thing only, and that's customer service, because it doesn't exist. Because it's a national service, you have no option. Well, 99% of people have no option but to use the NHS. So therefore, customer service, customer choice doesn't come into it, because what are you going to do? Where are you going to go? We don't care. We get paid anyway. We don't care about giving you a better service, making sure you get what you want. Because as someone who works in the NHS, it's not my problem, mate. How we address that, I don't know. But I would look at how do we bring back customer care, customer choice into this service. That will start improving things.
So there are two points. Firstly, in secondary care, that means hospital care. What we are saying is actually, when you look at the NHS hospitals and private hospitals, guess what? Private hospitals are far more efficient. They get through more operations. Of course they do, because time is money. What we are saying is that actually money needs to follow the patient. So the NHS remains free at the point of need. The money follows the patient. So if the NHS cannot see you in an allotted time, then you go privately, which is underwritten by the NHS. What that will do is cause a ballooning of the private sector, and therefore you then have competition built into that, because obviously the private units will want actually to be competing for business. And you, as the patient, can say, well, I want to go to this one because I've heard from Mrs. Miggins that this provides exemplary service. Nick touches on another very important point, which is about primary care. We have a very strange system in this country where GPs are paid on what's called a capitation basis. So you're paid according to the number of patients you have. Now, if you have X number, tens of thousands of young people, you're coining in the cash, but actually your workload is low. If you have tens of thousands of elderly people, then the money is the same, but your workload is much higher than that. So actually, shouldn't we relook at the way that we're paying GPs and actually pay them on outcomes? What are you actually doing? How many patients are you actually seeing? And I think that there is a lot of merit to that.
Did you like that video? I think you did. Hit the bell, give it a big thumbs up, comment, and don't forget, I'm standing for election in Oldham East and Saddleworth. So please share this video, speak to your family and friends if you live in Greater Manchester, and if you live in Oldham East and Saddleworth, make sure you vote for me. Catch you soon.